Hello there everyone, welcome back to the part 2 of the video. As you all know, in the previous video we discussed about very important topics that you guys were asking in the comments, and in this video again we'll be discussing about the important topics. So we again have both the Shannons in our video and
Shannon squared.
Yes, and if you haven't watched the previous video, then you can find it here in the I button. You can click the link and watch the video. Make sure you watch the part 1. That is only when you will understand things, and part 2 would be more beneficial for you guys. And right now we will be discussing about the top trends in the healthcare system in Canada. So over to you, Shannon, first.
Yeah, awesome. This is something that I'm actually really passionate about, and I actually teach health information management fundamentals. I was a part of building the curriculum at one of the academic institutions that I work at. And the reason why I want to talk about health information management fundamentals, or health informatics, is because this is a really booming industry in North America, but especially in Canada right now. In order to be a registered health information management professional, you can be certified under the Canadian Health Information Management Association. And it's a lot more of a streamlined approach to getting yourself integrated into the Canadian system, because as I'm sure you've heard, becoming a licensed healthcare professional in Canada is not a very linear process. There's a lot of flaming hoops of fire you have to jump through to become a registered clinician. But health information, digital security, data analytics, these are all fields that I would strongly encourage you to look into, because we are transitioning from paper documentation to electronic documentation. And so understanding the EHR, electronic health record, this would be critical to your ability to integrate yourself very quickly within the Canadian healthcare system.
It's wonderful. And over to you, Shannon, now. Why are the doctors leaving Canada and settling into US? They are not getting well paid. That's a big
because
topic
our
too.
system is very frustrating and very broken. And so one thing maybe your audience might not know is that physicians are not paid for by the hospital in which they work. They're not paid for by the clinics. They're paid for by our OHIP dollars. So in Ontario, it's the Ontario Health Insurance Plan. So it's our tax dollars that are paying physicians' salaries. So when they find themselves working in a healthcare system or an organization that is, for lack of a better word, broken, not performing in a way that they feel meshes well with their morals and ethics. And, if they feel their license is at risk or on the line, they will not stay working in a system where they feel that there's that much risk. So they see going to the States where things are private, you have more control in a private environment than you do in a public system. And there's a lot more money attached to it.
Yeah, even I would like to add, one of my friend got bitten by a squirrel. So he had to wait like 13 hours in the hospital just to get one tetanus injection. And in India, it's like even if you go to a chemist, it's just like less than $1 and you get it done in 10 minutes.
How long are some of the wait times for some people in emergency?
Days.
I got to know, even he told me that there was a person, he was bleeding, and they said if he's not dying, he's fine.
Life or limb. Life or limb.
That's right.
That's what it's referred to. And another thing maybe you didn't know about the Canadian healthcare system is we have something called the CTAS. So CTAS is the Canadian Triage Assessment Score. And when you arrive to the hospital, you're given a score from 1 to 5. 1 is the most severe. You need intervention immediately. You're, whatever, vital signs absent.
Yes.
And then 5 is like a squirrel bite. So if you come in with a squirrel bite, you're labeled a 5, which means you are very likely going to be waiting anywhere from 10 to 15 hours before you're even seen.
You're bumped.
Triage. Yeah, you're bumped by the triaging system, which serves the people who are the sickest of the sick first.
Right.
This is crazy. And do you think in coming years this will get better or more worse? You are in the healthcare industry, and I would like to ask this question.
I feel in the current community healthcare that I'm in, that it's going to get worse just because of population boom, and there's not the infrastructure that can hold the influx of population that we've had recently in our recent years.
We needed new hospitals 10 years ago.
Yeah.
And now we've just gotten approval from the federal and provincial governments to move forward with building a hospital, but that takes 10 to 15 years. And we needed them 10 years ago.
But where does the money go? They have a lot of money.
And in Ontario, we actually spend the most of all of the provinces across Canada. We have the highest GDP expenditure on healthcare across the province, and we just keep throwing money at the problem, and it doesn't seem to be.
They can lend money from nations. They can take help from nations. We have US supporting us next to us, but like there's no point, right?
That we are not properly using the internationally trained professionals who come to our country. We're not, as a country, we're not banding together as a collective to support that integration within the country well enough yet. And I think if we were bringing internationally trained healthcare professionals here and setting them up for success by creating Canadian experiences for them the second they land in the country, as opposed to, making them have no choice but to work these jobs at Tim Hortons or the grocery store or whatever. I think that's a big mistake that the government is making, is that we're making it far too difficult for people who are eager and willing to work in healthcare. We're making it far too difficult for them to integrate themselves within our system. And if we would have a lot more resources from a staffing perspective to make sure that our patient populations were being properly cared for.
It's a really big issue. And one thing I remember, I was traveling from Brantford to Kitchener and I took a ride. So the person, I just talked to him like, what do you do and everything. He said, I practiced healthcare in India for 14 years and I'm here driving a taxi.
Brain surgeon or
because
something.
Yeah, sure.
he said that I'm not able to get a job. And if I am, they are not paying me well.
So can I ask what the schooling is like to get them from where their doctorate from India to here? Like is it license? Do they have to upgrade? Is it all of those things? And how long do they have to start?
They have to start over.
It's a process over. So it's another 8, 10, 12, whatever years.
Yeah, they do their schooling and then they do their bachelor's, MBBS, and then they practice.
Nothing that they have from India carries over.
Not credentially.
Canadian experience.
Canadian experience.
Such a big thing. Every field, even like if you want a part-time job, just like to work as a stocking or something like that, they ask for.
I experienced this as a young manager. I would interview for these jobs and they'd say, well, you don't have experience managing people. And I would say, but how do I get experience managing people if nobody lets me manage people?
Yeah.
So when you're an internationally trained healthcare professional and they're saying you don't have Canadian experience, you're thinking, how do I get Canadian experience if you don't give me Canadian experience? Like,
if they
what are we
volunteer,
talking
they can
about
only
here?
get in so far as a volunteer into a hospital, right?
Yeah.
They're not going to be able to observe in the OR
Yeah.
or
And as we've
go
kind
on
of talked
rounds.
about over the course of today, it's not what you know. You could be a brilliant brain surgeon, but if you don't know anybody to put you in the right rooms with the right people,
Definitely.
you're going to be driving an Uber. Like you're going to be driving Papa Ride.
Definitely. Connections are very important. Yeah. And then after this, we would love to talk about LinkedIn, which is a great platform
Great
to
segue.
connect with people. And that is how I got connected with Shannon. And currently, I'm developing her website, Olive Branch Mentorship, with one of my friends, Shakila. And we would love to talk about LinkedIn. Like, how long have you been using LinkedIn?
I am one of the OGs on LinkedIn. I've been on LinkedIn for, I think I just had my 13th anniversary on LinkedIn.
Oh, wow.
Yeah.
13 years?
Yeah.
I'm
You
21.
were almost born around that time.
Crazy. LinkedIn is that old?
Yeah, I've been on LinkedIn since 2011, 2012. Yeah. Now, not to the same capacity that I use it now. Like I have to say there was a solid decade where I wasn't using it to its full capacity. But I found actually with teaching that I would have students reaching out to me on LinkedIn more and more. And then, of course, when you start your own business, you realize that you have to have people and you have to, have a community and you have to create a safe space for, conversations to happen. And LinkedIn has been the way that I've been able to extend the olive branch, as we say, to incredible people who will end up, creating opportunities for you. And I think, LinkedIn is a way to build those connections, meaningful connections.
Yes.
And it's also a really good platform for building your brand, your personal brand.
And how about you? Like, how long have you been using it?
I've been on it. I've been using it for, I'm going to say 5 or 6 years, but I'm not actively using it. I think it's changed. And that's one of the questions I was going to ask. Like, how has it changed and what would you use?
It's become like the Facebook of professional development. But one of my kind of qualms, I would say, with LinkedIn is that very rah, everything is positive, and look at the promotion that I got, and not a lot of like honest, transparent conversations around how difficult the job search is. And like,
It's almost every social media. People showcase the life which is good rather than the life what is going on with them.
so that's good advice for
Everywhere.
you. If you're kind of looking in, from another country and you're looking in at the Canadian workforce culture, like just know that what you see is the highlight reel, and you have to make sure that you're aligning yourself with professionals that you trust who are going to be honest with you about the experiences that you might come into contact with. Like we're in a very uncharted territory right now with the political climate. We're neighbors to the US, and they're going through a big presidential election next month. And that, as Canadians, we experience the residual aftermath of those political, things that are happening, and the workforce and just general societal culture, all of those things are directly linked to politics and the economy. And so that's a good thing for you to kind of keep your finger on the pulse with, is what's happening.
Definitely.
Yeah.
Over the border.
Over the border.
Over the border.
Yeah.
And when you're using LinkedIn, don't use it as a purpose just to showcase your jobs and everything. Showcase your life.
Yes.
I was going to say, so how would you use a brand? How would you suggest somebody start as using LinkedIn as a brand?
As a brand, I would say, let's say if you're new to LinkedIn, start with firstly updating your LinkedIn. Make sure you have your experiences, any volunteering, and
Every single certificate you do. Every single certificate
every
you
single.
do. Accessibility training, first aid training, every single certificate, save it as a PDF and upload it to your LinkedIn, basically like your own professional portfolio.
Yes.
Okay. You want to showcase every single accolade, because in North America, we put a heavy emphasis on that continuing education. So you can have your degrees and you can have your master's and, PhD and all of that. But even at the PhD level, they're looking for that continuing education commitment to certificates and attending conferences and going to summits and networking events, and showcasing that part of yourself where you're actually showing a commitment to your growth. This is what draws the attention of employers. You cannot sit at home in your dark room applying to 50,000 jobs on Indeed, in the week. That's not going to get you a job. Not quickly. Yeah.
So these were such an amazing tips on LinkedIn, and then you guys got to know about the trends in the industry, right? You got to know about the real insights in the industry, because only the people who are working and are in the industry since so long can guide you on it. And Shannon has her own YouTube channel. You should make sure to subscribe it. You will find the link in the description. And then another Shannon has also her channel, which is upcoming soon.
The Shanzy Vibe After Dark.
It'll be an extension of the Olive Branch. Yeah, we're the All of You podcast, actually. So the All of You podcast can be found under Olive Branch Mentorship Incorporated on all the places where social media happens.
That's right.
Definitely. And make sure you subscribe it.
Please
and
do.
if you want to ask any questions, you can connect them on LinkedIn.
Yeah.
So I'll list their LinkedIn in our description. And as always, thank you everyone for watching. Have a good day. जल्दी मिलते हैं आने वाली अगली वीडियो में. तब तक के लिए goodbye and take care.